So the type, duration and intensity of physical activity that you are doing can make a difference on your blood glucose levels. Longer durations of exercises can increase the risk of hypo. Aerobic exercises such as walking, tennis, cycling, jogging and swimming are likely to lower your blood glucose levels. Strength and explosive exercises such as lifting weights, using machines and free weights, perhaps using resistance bands and sprinting are actually likely to raise blood glucose levels, but can also drop them, particularly if undertaken for a long period of time. Flexibility and stretching exercises such as yoga will have little effect on blood glucose levels. Activities which consist of a combination of different types of exercises such as football, these can cause glucose levels to go both up as well as down. So blood glucose considerations when performing structured exercise include: firstly, do not exercise within 24 hours of a severe hypo. But if you've had a mild or moderate hypo, then you can exercise, but with caution, as your risk of hypo is still increased. So the type of exercise you perform and the time of day you exercise may cause different glucose responses. Always carry hypo treatment with you when you exercise. 15 to 20 grams of a fast-acting carbohydrate, such as 4 Jelly Babies, or a 200 ml carton of fruit juice. Remember that glucose levels can fluctuate when performing new and particularly unfamiliar exercises. There is an increased risk of overnight and next day hypos if moderate to vigorous exercises is undertaken in the afternoon or early evening. Glucose levels should ideally be above 6 millimoles per litre before starting any new exercise, and checked every 30 minutes at least when you are increasing the amount you exercise or performing a new form of exercise. So the glucose level, whether that's through blood or sensors, should be checked more often after finishing exercise and up to 24 hours after this, especially if you are new to the exercise you are performing. Exercise should be avoided if blood glucose is above 14 millimoles per litre, particularly if ketones are present due to the risk of diabetic ketoacidosis. Eating a starchy carbohydrate snack, such as cereal or pasta before exercise, can help to prevent the risk of hypoglycemia. More carbohydrate after exercising may be required. The carbohydrate amount needed can vary, so our advice is to speak to your healthcare professional or watch the video links below for further information. Avoid exercising within 2 hours of a quick-acting insulin injection, as there is a higher risk of hypo. Do not worry, there is plenty of help and support available to you when increasing your physical activity levels when living with type 1 diabetes. So if you would like more information about exercise and type 1 diabetes, or more information around managing glucose levels and exercise, see the links at the bottom of this page for some very informative and helpful videos.